This is the video on speech and language. There is a difference between speech and language. Speech is the expression of or the ability to express thoughts and feelings by articulating sounds. Language is the method of human communication, either spoken or written, consisting of the use of words in a structured and conventional way. Speech is talking, and language is what you say when you talk. A person can have language without speech, and as we shall see, a person can talk without language. The area of the brain involved with speech is Broca's area. It is in the left inferior frontal lobe, as the left is the dominant side of the brain in most people. It sits very near the motor strip, which makes sense since Broca's area is involved with the motor skills needed for producing words. If a person has a stroke in Broca's area, they cannot speak well, but they can understand language, read, and write. Wernicke's area is in the left, again, the dominant side of the brain, superior posterior temporal lobe, and helps mediate language comprehension. When a person has a stroke in Wernicke's area, they can talk, but they cannot understand language, read, or write. This is far more devastating than losing Broca's area. Some patients with severe seizure disorders have the corpus callosum split to separate the two halves of the brain. This is known as a corpus callosotomy, or a split brain syndrome. This surgery is not as easy as the picture shows. After the surgery, the right side of the brain cannot communicate with the left side of the brain. These individuals have been tested over their language skills. In the first picture, the box is presented to the left visual field. This goes to the right occipital lobe for processing, and then crosses over to the corpus callosum to the left side of the brain, and the person can say, "It's a box." In a split brain person, the box presented in the left visual field goes to the right occipital lobe for processing and then cannot cross over to the left side to Broca's area. This person cannot tell you it's a box. If you present the box to the right visual field, the left occipital lobe processes it and the person can say, "It's a box." Language is not just the spoken word. It is also reading, writing, listening, and understanding. When a person in an fMRI scan is asked to look at words, the occipital lobe lights up as vision goes to the occipital lobe. When a person in an fMRI scan is asked to listen to words, Heschl's gyrus in the superior temporal lobe lights up, as well as Broca's and Wernicke's area. When a person in an fMRI is asked to speak words from a list, Broca's area and the parietal association area light up. When a person in an fMRI is asked to generate word associations, understanding the meaning of the word, Broca's area and the posterior temporal association areas light up. Language uses up a large component of the left side of the brain. Primates have been tested in their ability to learn language. A famous great ape, Koko, learned to communicate using a keyboard of 45 tiles. Koko would talk to the trainer using this lexicon and was very good at letting the trainer know what she wanted. The lexicon is made up of symbols and words. During her time training, Koko adopted 2 kittens. She took care of these kittens as if the kittens were her own young. Her language skills improved after the kittens were introduced, and she grieved when one of the kittens died. And this ends the video on speech and language.